Hey guys, it's Charlie Francis, and today I finally picked up my testosterone, so I'm getting ready to do my first injection. Before we start, this is my voice 0 days on T. Alright guys, what's good? It's Charlie Francis, back with my first injection of testosterone. So I am a critical care nurse, and this is how I give my patients sub-Q injections, so I will just share some of this with you. So I'm a little neurotic and I like to have a clean, in this case I use a pillowcase because it's available and it's free and it's wrinkled, but that doesn't matter. I have some alcohol prep pads that I did not steal from work. They are from Rite Aid. I have a bottle to get rid of my sharps. I plan on getting a actual sharps container, but haven't gotten there yet. So my doctor prescribed the BD 25 gauge 5/8 inch needle. Looks like that. I don't think this has a safety lock, so just be careful. And then of course the testosterone. So bear with me with these awful camera angles as I try and go through this, doing this on my own with my phone and my cat beside me. So the first step anytime you inject anything into anywhere is to wash your hands, which I'm gonna save you the trouble of me doing because I just did it about 5 minutes before starting this video, and you all should know how to wash your hands. Oh, my hair's getting crazy. Getting it cutted too today, thank God. But anyway, to start out, I just go ahead and open my supplies. So, oh geez. Sorry for the balancing act here. See how this goes. Just gonna open that and drop that onto my pillowcase. Open my testosterone. Now you can read this insert if you so want to. I know how to give sub-Q injections. I've already talked with my doctor about the side effects, the dangers, the pros, cons, so I'm just going to put that there. And then here is the actual testosterone bottle. So I am prescribed 100 milligrams every 7 days. So this comes in 100 grams per milliliter. And if any of you other fellow nurses remember nursing school, you remember doing 1.5 billion these conversions. So on my needle here, that focuses. There we go. You'll see that the 1 milliliter mark is right here. So these syringes are in milliliters, not milligrams. So make sure that you do that conversion. Make sure you double check the amount that's on your testosterone bottle. So I'm going to go ahead and draw up 1 milliliter. Oh, good Lord, this is a bad angle. But I'm gonna go ahead and drop my testosterone. So take one of my alcohol pads and I'm going to literally flip the cap off of the testosterone bottle. Now, you can sometimes skip this step because this part is supposed to be sterile when it comes to you if it's unopened. However, I like to just clean the top with an alcohol wipe for about 15 seconds. And let it dry. So the important thing when you're using alcohol swabs is to let it dry. Let it dry on your body, let it dry on your testosterone bottle or whatever you're pulling from. That is what kills the germs and prevents burning. So second trick, well, not trick, but second way I do this is I'm going to carefully remove the cap from the needle, pull back to 1 milliliter of air, just air. going to put it in my testosterone and push the air into the testosterone bottle. Once you have put the air in, flip it upside down and begin slowly pulling out the testosterone. Now, testosterone is a lot more viscous than, let's say, insulin or pretty much any other medication you might be injecting. So it's going to take a little bit of time to pull it out. So now I'm at the 1 milliliter mark. So then take that out, push out any extra air. Also make sure you're getting a drip. I like to just make sure I have no air, no bubbles. There's that, 1 milliliter. Sorry, my camera's not focusing. So now what I do is I take my other alcohol swab and yes, I know I wear high pants. So you want to go about 2 inches from your belly button. So it's about like a middle finger length. So about here. I'm going to clean around it. And I'm going to let that dry. Kind of a pain having this extra step, but it'll help in the long run. Now there's 2 ways you can do this. You can either inject directly at a 45-degree angle, or you can pinch the fat and put it in. I like to just pinch and then making sure the bevel on the needle is up. Oh, I wish that would focus. When you look really closely at your needle, you'll see there's a tiny, at the end, a tiny bit of what looks like extra needle where it sticks out a little bit. You want that facing, you want the hole facing up. So then what I do is just go ahead and inject. So I'm going to go ahead and put this in. And then I'm going to slowly push in the testosterone. So this is viscous, so it takes a little bit longer. You just have to be patient. Almost there. Now this point is important. If you did grab the tissue, release it. I like to palpate around just to make sure everything is in there. Remove the needle. Sometimes you'll have a little bit of bleeding, sometimes not. I just use the alcohol swab and go over where I just did. So these needles do not have a safety, so you want to be really careful. So what I'm going to go ahead and do is I'm going to take the cap, slowly and carefully put it back on. And I'm going to take my bottle and put it into my sharps container. If you notice any bleeding at the site, little band-aid, if you notice you start getting like a rash or heat, or if it starts streaking red streaks, those are signs of infection. You definitely want to call your endocrinologist or your doctor, whoever prescribes the tea, and let them know. So yeah, that's about it. Afterwards, I just put the testosterone back into its box. And I do not re-put on the orange cap because at this point the seal's been broken. There's no real point in doing that. You just want to make sure you wipe the top with alcohol every time after the first use, let it dry, and that's it. So that was my first testosterone shot on myself. And I'm really excited to see the effects. So I will check in with you guys later. All right. Thanks.